Hi, welcome to our Speaking of Women's Health series on menopause, a how-to survival guide video series. Today we welcome back Dr. Holly Thacker, one of the nation's foremost experts in women's health and the director of the Cleveland Clinic Center for Specialized Women's Health. We're so glad that you're back with us again today, Doctor, because we're learning so much with you on this topic. Today we'd like to cover what are the signs and symptoms of menopause and what might a woman start to look for as she's just entering menopause.
Hot flashes are the classic symptom. They start from the chest, neck, and go up to the head, last up to 10 minutes. They can be mild or they can be severe. And they tend to be more common at night. Dry vagina, dry skin, hair thinning, changes in sexual function, energy, sleep. These can all relate to fluctuations or changes in hormones.
Now, what about mood swings? I know that affects everybody in your life.
Well, the lack of hormones actually are not associated with psychiatric problems per se. However, if one is having hot flashes, that disturbs the sleep. If you're not getting enough sleep, you're going to have a bad mood, at least.
Right.
And prolonged sleep deprivation can lead to depression, anxiety, panic attacks. And certainly women who've had trouble with hormones, postpartum depression, PMS, they may be more predisposed to having mood problems at the time of midlife.
Now, doctor, for women who may have had a hysterectomy, is there anything they need to know about entering menopause? Might it be different for them?
Well, for women who've had a complete hysterectomy, which includes the uterus and both ovaries being removed, they immediately enter into surgical menopause because they have no more eggs, no more ovaries, no more estrogen. So that's pretty abrupt. For women who have their ovaries but just the uterus is removed, they can't use their menstrual period to find out when they go into menopause. So many times they need blood tests or they need to pay attention to symptoms to find out when they enter into menopause. You don't go through menopause, you enter into it.
Doctor, you mentioned a blood test for menopause. I've never heard of such a thing, and I wondered how accurate is that and what exactly does that entail?
Well, currently we cannot predict when menopause is going to happen, which would be nice for a lot of different reasons. However, if you don't have a period and you have hot flashes and you're the right age and your FSH blood test is very high and your estrogen level is very low, that certainly signifies that you're going into menopause.
For more nationally leading insights on women's health from Cleveland Clinic doctors, please log on to speakingofwomenshealth.com. And while you're there, sign up for the Speaking of Women's Health e-newsletter. It's free and it offers a lot more great advice and guidance.